And Liz Morrell. Catherine's, there she comes.
Yield my time to Jill Hines.
Ma'am?
May I yield my time to Jill Hines?
You need
That's
to,
Robert's rule, isn't it?
Ms. Hines has a way, doesn't she? Why don't you go ahead and start and tell us, and then we'll discuss that in just a second. Go ahead, please.
Good morning. I'm Liz Merle. Some of you know me as our Solicitor General in the AG's office. I'm not here in that capacity. I'm here as a very angry mother. I was in my office sitting here watching this testimony begin, and I heard Dr. Cantor and the other witness from LDH, who I've never met, give you their statistics. And that it shocked me so much I got out of my chair and came over here to testify. This is a broken system. It is not built for reporting adverse events. And my son had myocarditis. He had it in May. He was in the hospital in pediatric ICU for 4 days. He had an immunoglobulin IV for 14 hours for an infusion, 15 hours, to stop his body from attacking itself. And then he was there for another 3 days while they monitored him. And we're still under supervision from pediatric cardiologists. So I wrote a letter to them 3 weeks after he got out of the hospital. They all called me, by the way. I talked to Dr. Cantor. I talked to Dr. Phillips. I talked to Steve Russo. I talked to the governor's office. They all called me to see how he was doing while he was in the hospital. And then after that, crickets. And I wrote a letter to them 3 weeks later when I saw a video that they put up to encourage vaccinating children. And it spends 10 minutes minimizing the significance of myocarditis. So I wrote a letter to them with data about myocarditis in children. Again, crickets. Asked them to take down that video because it is peddling flatly false information about myocarditis. They continue to say that myocarditis is mild and that all of the events of it have been mild. There is no such thing as mild myocarditis. And so I'm here to tell you have a broken system. It is not built for reporting events. They all are deciding about whether it was caused before they report. My doctors thought about it for 3 days. They finally concluded that it was necessary that they report. I had already submitted a report to VAERS. They knew about it. They've never called me. Never. So my kid was the first case reported with myocarditis in this state. They've never called me to investigate. And I don't know where they get their numbers from. I think you've got a system that is built to dismiss adverse events, to vaccinate as many people as possible, and to diminish any concerns about adverse events because that causes vaccine hesitancy. So you do have false numbers. Their numbers are false. Their numbers are false because they don't really want to know. And so, I'm just telling you, I think it's a bad system. I think you need to make sure that that people report. You need to protect people who do report. These nurses don't have that protection.
Thank you very much. And I think we all certainly agree with you in that vein that they do everybody needs to report that. That's been over and over the ongoing theme here.
And they need to take that video down. I asked them to do it. I mean, they've never responded to my letter. Never. Because they are intent on convincing everybody that it is not dangerous, that it doesn't hurt your children, that it doesn't hurt you. And so that encourages more people to get vaccinated. I'm not anti-vaccine. I'm vaccinated. I let my son get vaccinated, all of them if they want to be. But, he's had a serious adverse event. And I don't know what they consider to be in the 3. I don't think they counted my son because they've never called me back. So how could they count him in the 3 that they confirmed? What they consider to be serious, they are judging whether it's a serious case or not. And then they count your number. And then they tell you, oh, we've only had 3 that we've confirmed. That's just wrong.
I appreciate you coming by. Thank you, ma'am. Now, you and Ms. Hines.
She actually didn't know.
I really don't know what myocarditis is. Can you tell me how it is and how it affected your child, because I mean, a lot of people can't identify it because they don't really know what's wrong.
So yes, myocarditis, and I'm not a doctor.
I know
but
you're not
my
a doctor,
son had
but
it,
but
and
you
I've
saw your
certainly
son
read a
had
lot
it, and
about it and
that's why I'm asking
right.
you. You're a first-hand candidate here.
So myocarditis is an inflammation of the heart muscle,
Right. Okay.
and pericarditis, which is another
Similar
similar
infection.
event that's been occurring, is an inflammation in the lining of the heart.
Right.
So they're both heart-related problems,
Right.
and they still haven't quite figured out exactly what the interaction is that is causing this to happen.
Yeah.
But they have identified it and associated it with the 2 mRNA vaccines, and they are dramatically higher numbers than what they expect to see in the ordinary population of young adult men primarily.
Right. And
So
how
when
old was your kid?
He's 17 when he had the vaccine and the.
And how did you come by knowing else what it was, and how did it affect him?
So he had the vaccine. This was the second dose, and all of his symptoms started less than 24 hours after he had the second dose, and they included severe heart pain. And I knew something about myocarditis already, and so I insisted that he go to the hospital. And the first experience he had at the hospital, he was in Texas, going to camp to be a counselor, and they dismissed it. They diminished the symptoms. They said that they didn't think it was anything, even though the research was just popping that day
Right.
on myocarditis and its association on the vaccines. So I called our pediatrician here and said, do you think we should run some more blood work? And he did. And that resulted in him being hospitalized with, there's an enzyme your heart throws off when you have a heart attack.
Yeah,
it's
right.
called troponin.
Yeah.
And he is, the ordinary range is 0 to 0.03. When he tested about 36 hours later, his troponin level was 14.
Wow.
I mean, that is a ridiculously high
that's
number,
a high
and
number.
he was very sick, but he felt okay. You know, like he had some heart pain, and then
Yeah.
it went away, and so it really is. That's why it's significantly underreported, because a lot of people may not have serious symptoms, or their symptoms may go away, or the doctor or somebody just says, well, go lay down, and so they don't track it very closely.
Yeah.
If they were running blood tests on every person that was in this risk category within 24 to 36 hours of them having the vaccine, I would say 36 really, or 48, they would have a lot better data, because they would see what was happening in their bloodstream, which is the best indicator that they are having a significant reaction.
Right.
So they're not doing that. You know, and I would point out, even though we're not here to talk about liability and numbers, the bill that I got just for his hospital stay, and I'm grateful that we have really good insurance, but it was $75,000. And he still has to see pediatric cardiologists. Nobody's paying, I mean, my insurer and I are paying that bill.
Yeah.
I don't know who, nobody's paying that bill for people who don't have that good of an insurance, much insurance coverage.
And so that's why I wanted to ask you, because a lot of times, we talk about a condition, but we never tell us how did it affect him. He started to feel sluggish. Then he went to the doctor, and that is not, probably not being reported, because there's probably been mild cases of it, and that's what I wanted you to do, kind of tell me, what happened, and
here's my concern, Representative Cox, and I put this in the letter to LDH that I sent when I saw the video they had posted diminishing the significance of myocarditis, is that many young adult men will never, and women that get it, but you may not know it.
Yeah.
And you may go on to have track or football practice. I mean, at this time, my son had it at the end of May, and we were looking at this big rollout of young people being vaccinated, and then they were going to go into two-a-days and cross country and volleyball. Everybody was going back to school and going back to athletics.
Yes.
Well, his activities were so restricted after he had myocarditis that he couldn't even mow the grass.
Wow.
So, they don't let you do anything once you've had myocarditis for 6 months. And then you go get a stress test to see if you have any permanent heart damage. He had to wear a Holter monitor. He's had to have multiple tests. And now, I mean, he's doing well, thank goodness. But he will have a long-term history of having had myocarditis. This will be part of his vaccine record. It will be part of his permanent record.
Right.
And I just don't, I think that it is wrong to send these kids out pretending like this is not something that's a big deal. And let's just let them go run the risk of having a heart attack on the
So your recommendation would be that they be informed when they take the shot, saying, hey, if you have any heart pains, you need to go to the doctor, and the doctor, because that's not being done, and you're saying, right?
I think the informed consent aspect of this is very concerning. And I looked at, to your point, just 2 days ago, I was looking at an informed consent document that you can download off LDH's website. And unless I misread it, it didn't say anything about myocarditis. And I don't, this is for the minor consent form. It's really not giving people adequate information. And now we have all of these mandates that are coming out. And it's not just for minors, right? I mean, it affects all adults and a significantly different data for young adults and young adult men than for some other age groups. So when we talk about the statistics and the millions of people who've been vaccinated, you really kind of have to look at these events sometimes in the context of the relevant population. And for young adult men, it is a much higher statistic. They are at much greater risk. And the numbers, they're not being, it is not fair to them to say, everybody has to go get a vaccine. You're going to lose your job. You're going to lose, everybody's got immunity. And don't worry about the risk. It's no big deal, because what they care about are mass numbers. And that's fine. That's what epidemiologists care about. And that's what public health people care about.
In the data aspect of it, I wanted to know, because I got a couple of grandsons and they had the shot and they didn't seem to have any problems. And a lot of people don't. But I wanted to know, because I wanted, if someone was to ask me, and you prescribed, and you really kind of told me a lot more than I thought, but it's great, and I appreciate you coming back to do that, because I know I'm holding you from your job, but I appreciate you coming over to testify as well, because you told me something I didn't know.
I do feel very strongly about this. I think that it's been unfortunate that the push has been to minimize reporting, and that and I will say this, if you permit me, there's a big difference. Like in law, if this was a car wreck and someone started to experience symptoms immediately after, like my son did, for example, there's a presumption in law for causation. And so all the insurance companies have to pay for that, because it's presumed, or the tortfeasor pays because of this presumption in the law of causation. The medical community, and I'm not criticizing them for this, but they approach this differently. They look for any other reason that might explain it. They are disinclined to draw the conclusion that it was caused by the vaccine if there's any other possibility. And so I think it is important that just the events be reported, because that's the raw data. When they talk about whether it's a mild case or everybody's symptoms resolved, this really diminishes what someone experienced and what the nature of the event was. For example, if it was myocarditis. There's no such thing as a mild case. I don't know how you could say that it wasn't serious when my son was in the pediatric ICU for 4 days to get
and that was the reason I called you back, because I asked that you come back because I wanted, you say he'd been in there 4 days, the difficulties that he's gone through, and I wanted to hear it, because I want to know how it's being reported. And matter of fact, I want to go back and ask a few doctors myself a few questions. So I want to really thank you for coming back.
I did follow this up on the reporting. I continue to do that. I have reported in VAERS. They've never pursued it. They've never called me back. They ignored my letter.
Well, they probably will call you today. They're watching.
Well, trust me. I think that I think that the push is to ignore or to diminish that information, and I think that's a problem. But
Well, I hope that we get beyond that. We're in some really difficult times, and things are much different than I ever would have expected in my lifetime. So, thank you.
Hold up.
Oh.
You're popular.
You're very popular.
Representative Cruz.
Thank you, Mr. Chairman. Hey, thanks for relaying your history. I'm sorry you had to go through that and he had to go through that. I just a couple questions first, some background. Had he had COVID before?
no,
Okay.
not
And
that,
how
not that
old-
we knew of. I mean,
How old was he at the time?
17.
17. All right. Given what you know now, I'm looking at a rate of 0.0027% of people suffering from COVID from the age group 0 to 19. So if we had more reports on this, this might tend possibly to say, hey, maybe we shouldn't do it. That's the least at risk age group already. So why would we do this if we can have some serious side effects like that? So you think this reporting is very important to accurately cover just what the risk is, huh?
Absolutely.
Okay. You said something about presumptive period in law, and I saw that in the military, and I'm sure Colonel Cox did too, that we had a 1-year presumptive period. After you separated from active duty, they said, hey, if you're sick from anything, we're going to presume it was from active duty for a period of one whole year. So I agree with you on that maybe we need to change the way we look at that presumption. Can pharma promote these boosters and vaccines right now? Do you know?
Can the farm?
Can they advertise them for me? Right.
I don't know. I
Okay.
haven't seen them advertised.
From what I
I've
understand,
seen public health commercials promoting
Reporting now.
vaccination.
Stay on reporting, please.
I'm still
I
trying
know
to stay on
you
that.
get off on that. Look, I understand, Representative. We're all out
I
of
haven't-
the
Well, what I'm trying to say is they can't right now because they're not FDA approved, but we need this data to be able to see, should they be able to do that? Should they be able to promote it? And the only way they can do it is if we have accurate reporting. So only LDH really and health agencies can promote it, not
And
pharma.
when you see those ads, by the way, I mean, everybody sees those ads. They all have a very, someone who sounds like he's someone who speaks very, very rapidly and says all the things that could go wrong, including death.
Yeah.
They just they run through a whole list of positive, because they are legally required to do that. If they're advertising a drug, they have to tell you what the significant adverse events would be.
Sure.
So you're not seeing that either, even with the public health record.
To go to the whole root of this thing, the foundation of science is data, right? And analyzing data, looking at data. So can we truly expect a medical professional to make an informed decision and give good advice if they don't have the data of the risks? I mean, if we glean all that and just say one or two, can they actually be expected to make an informed decision to tell their patients, yeah, I recommend this, I don't, given your age, your health conditions and whatnot? Do you think we can do that?
I mean, I think it's very difficult, and I saw that with my son in the beginning, because there wasn't a lot of information about this. Israel was the first country, I think, to actually produce some data on it. That report was being promoted was coming out, I think, in the New York Times and the Wall Street Journal the day my son experienced his heart pain. I mean, that's how I knew about it. Frankly, I Googled heart pain and COVID vaccines, and those articles came up 30 minutes after I had spoken to the nurse at the camp and said, I'm not comfortable with this, please take him to the emergency room. And so, they dismissed the symptoms because it is a relatively rare occurrence with young people. Maybe even then they don't have adequate information because they can be asymptomatic but still have had it. And so, I think that everybody can only act on the information that they have. And if we aren't actually aggressively trying to get that information, and we have a system that is built to push back on collecting that information because of other factors and other needs, we're just not getting accurate data. And so it continues to create a flawed reporting system. I'm not for or against vaccines. I mean, a lot of people should get that. I get it. I think that we need to get accurate data, and we should be agnostic as to the reason for it. We just need to get the data.
Is there any, speaking as Solicitor General now, Is there any chance of culpability coming back on LDH, the state, providers, hospitals, or something if they know this data and aren't reporting it? Is that a threat, a concern of theirs, or should it be?
We certainly have been we've been examining issues related to informed consent and interfering with people's consent. I mean, the doctors, I can't speak to the liability. I think that is a complicated question that's been further complicated by immunity provisions that have been granted related to COVID. But I do have grave concerns about all these mandates, and that creates a wholly different situation. So.
Okay. Thank you very much.
Thank you, Representative. Representative Beckles.
Thank you, Mr. Merrill, for being here and giving your testimony. I guess mine more specifically rolled around whistleblower protections, and if employees of hospital systems or medical systems are being told not to report this data, specifically told, would they be in a whistleblower protection type system, and then could they file some form of suit? I know we have all the protections for the vaccine, the mandates, and I get all that, but this is specific towards being told by your superior not to do something.
I think that's a complicated question because I don't think we have clear whistleblower protections for this. Someone's supposed to report. It's not real clear who is supposed to report. And I think that, I've certainly received lots of phone calls once I sent that letter back in May. I know that a lot of nurses have been concerned, but the nurses report and are usually under the supervision of a doctor in the hospital. If a nurse steps out and reports against the recommendation or advice of someone who supervises her, she might get, or he might get in trouble for doing that. So the reporting system gets complicated by the supervisory system and who's supposed to do what when. And I think that we should have more protection for that, and we should have more clear reporting obligations. Like this, if you think about mandatory reporting for abuse, we have a wide group of people who are subject to mandatory reporting. It includes nurses, doctors, counselors, a lot of teachers. A lot of people are required to report, and it doesn't matter if they are doing multiple reporting because we can deduplicate the reporting. What we can't do is capture failure to report. And so I think there's a lot we can do to improve this. Whistleblower protections do help protect the person who reports, but I think that even now we still have a lot of fear. We have a lot of fear from people being about reprisals in the workforce related to COVID vaccine.
Well, and it's why I commend the nurses that have come here today, and I would hope, for the sake of those that would be doing something that I would consider a really bad thing to do, that they're not put in a position where they lose their job or anything of that nature, because that would create a much bigger problem. I think we brought the attention to the 800 number, which I just found out about last week, as probably you and many others in this room. In fact, that's probably what started this inquiry, was to try to figure out, how do you report this thing? My last question is...
could I speak to that for a minute?
Absolutely.
The 800 number, I consider it like VAERS. It's a black hole. I reported in VAERS while my son was still in ICU, in the pediatric ICU, and I got a letter last week that said, we may call you about this. It's been 5 months.
Wow.
There was no real question. It came upon him immediately. It's just like, and there's been no request. They sent me an email and asked me for some information that was in my original report. They gave me a phone number of someone to call. I called it 5 times, never got a call back. There was a person and a phone number associated with that email that said, you can call this number and ask for this person. I did it 5 times. They never called me back. So, and LDH, I know all of them. They've never called me either. So I don't know how that system works. But my view of it is it's a black hole.
I would hope that our media outlets that are watching this on TV today, that are in the room, would at least have the guts to produce this 800 number publicly, so we can share this with the general public, again, to protect in situations like your son, so at least we have the data and can make better decisions going forward. And I guess lastly, maybe someone from the AG's office can do an inquiry to see if one of those 3 cases that they have reported is your son, to ensure that data integrity is on the up and up.
Yeah, as a parent, I think I should be able to know if one of those three is my son. But I mean, I'm assuming that since no one's ever asked me after, other than as a personal, how's he doing, which I am grateful for. I mean, I don't want to sound like I'm not grateful that
Sure.
they checked on him while we were in the hospital and called to see how he was doing. They did, and I was grateful for that. But there's been no medical inquiry. No one's ever asked for his medical records. Nobody.
Thank you for having the guts to come up here and do what you're doing.
Hold up. Do you see what you started? All right, Representative McMahon, your turn.
Yes, ma'am. I want to thank you for being here today and testifying as an eye-opener. We've been asking for a while about the LDH, about the reporting system and how accurate it is. And, we see a lot of different things. But was yours reported through the medical facilities? Did the doctors or the hospital, did they report it like they should, you felt like? Or do
They
you know?
concluded they had a legal obligation to report, but that if I had already done the report, then they didn't have to. And I had initiated the report. And just as an aside, I mean, it's not easy to report. I went through this process. I have 3 degrees. I have 4 if you count my high school degree. I mean, I had to walk through this system. And it asked for every test that he had undergone, the results of those tests, the doctors that had dealt with him. I mean, at that point, I was in ICU. We were having tests every 6 hours. We were having, a lot of different tests conducted on him with a lot of different doctors. And I had to fill out all of that detail in the report. It's not an easy system to navigate. And then even the compensation system's even more difficult to navigate. And I've been doing it just to see what it's like, so that I can testify about it, and I can draw attention to how complicated it is, and how much of a system how much it is built to discount the event, not to count the event.
Thank you.
Well,
And
I appreciate your testimony. It's kind of ironic that your son and one of my best friends had myocarditis on the opposite ends of the state. And, as a legislator, we have to have valid information to make decisions about what we come into committee about. But as a parent and a grandparent, we need good information so we can form a decision on what we need to do with our own health, too. And I appreciate you being here today.
Thank you, Representative. And tell the Attorney General, thanks for loaning you to us for a while.
He didn't even know I was coming, by the way. I got out of my chair and came straight over here.
I'm going to bet he's going to know. All right, I've got two more people.
Keep you that long, but I had to ask you that question.
All right, Christy Hake.